So today our topic is on periodontal medicine. So coming to the definition or what do you mean by periodontal medicine? In simple words, we can tell it as the impact of oral infection on systemic health. This means that there is a two-way relationship in which periodontal disease in an individual who have a powerful influence on individual systemic health. That concept is known as the periodontal medicine. Coming to the definition, Offenbacher in 1996 defines periodontal medicine as a rapidly emerging branch of periodontology which focuses on the research of new data, establishing a strong relationship between periodontal health or disease and a systemic health or disease. Coming to the history, ancient civilizations like in Hippocrates described a patient as a rheumatism whose arthritis has been cured by the extraction of tooth. The same way, Galen, the Roman physician, who told that head is the source of all illness. So, many studies were conducted on this aspect. And during ancient times, it was concluded that the oral microorganisms are mainly responsible for the systemic conditions. And William Hunter in 1900 proposed a theory that is the focal infection theory. According to him, he told that the oral microorganisms that is mainly responsible for the systemic conditions. And he suggested that we have to extract the tooth instead of restoration. According to him, he told that there will be trapping of infectious agents if we try to restore the tooth, and gingivitis and periodontitis can act as a foci of infection that will cause a high impact on other patients' systemic health. So, in 1940s and 1950s, the focal infection theory got disrupted. That is mainly because, as per William Hunter's theory, it is suggested that the patient the teeth has to be extracted instead of restorations. So, even after the extraction of tooth, the systemic disease continues the same. So, the theory failed to explain the oral systemic link. So, the theory got disrupted in 1940s and 1950s. So, the organ systems that are mainly associated or influenced by the periodontal infection are cardiovascular or cerebrovascular disease, reproductive system, endocrine, and respiratory and CNS. So, today we are going to deal with the reproductive system, the periodontal disease and the reproductive system. The normal gestation time is about 40 weeks. So, birth at lesser than 37 weeks is called as a preterm delivery. And very preterm means the delivery should be less than 32 weeks. And extremely preterm means the delivery should be less than 28 weeks. And this periodontitis can cause a low birth weight in babies. So, low birth weight we can define as the birth weight was less than 2,500 grams. That is considered as a low birth weight. In very low birth weight means the birth weight should be less than 1,500 grams. And extremely low means the birth weight should be less than 1,000 grams. This is the very low and extremely low and low birth weight. So, low birth weight. The normal risk factors for the low birth weight patients are maternal age less than 17 or greater than 34 years, low socioeconomic status, premature rupture of membrane, drug abuse, malnutrition, alcohol, hypertension, pregnancies, and periodontitis. So, even after the infant survey, there will be increased chance of or increased risk of developing respiratory distress syndrome, anemia, jaundice, malnutrition, congestive heart failure, epilepsy, learning disabilities, impaired malfunction, etc. So, this is the normal term level chart. So, in this, the pituitary gland releases the oxytocin and PGE2 that leads to the uterine contractions. Then there will be a reflex stretch of uterine muscles. When there is a stretch of the cervix, the neuron stimulated at the cervix and there will be neurogenic reflex occurs. And this is known as the positive feedback mechanism. That is, it again stimulates the pituitary gland to produce more oxytocin. So we have to know how the periodontitis causes this premature labor. So the periodontal infection, as we all know, it is mainly because of the microorganisms. So it serves as a reservoir for the gram-negative anaerobic organisms. polysaccharides and inflammatory mediators, all these causes that's a premature rupture of membrane. It has been hypothesized that the periodontal infection, which serves as a reservoir for the gram-negative anaerobic organisms, lipopolysaccharides and inflammatory mediators, that poses a potential threat to the fetal placental unit. So, when there is a periodontitis or periodontal infection, the endotoxins will be released and there will be inflammatory reactions and the PGE2 cytokines, all this will be released and there will be rupture of the membrane or probe. So, there will be increased chance of low birth weight babies and preterm birth of the babies. And the remote microorganisms or remote damaging infections that may play a very important role in low birth weight infections. And it is noted that the P. gingivalis during gestation causes significant increase in TNF alpha and PGE2. And PGE2 is the main systemic inflammatory factor that can cause the rupture of membrane. So it is very much important for that. So this is all about the association between the periodontal disease and the reproductive system.